There is a lot of misinformation around about when you should have sex in order to improve your chances of conceiving. In schools, teenagers are taught that they could have sex at any time during their cycle and fall pregnant, but this is not accurate. The best time to have sex in order to conceive is ideally 2 to 3 days before you ovulate. This is your most fertile time and you have the highest chances of conceiving before you actually release an egg. Of course, this leads to the problem of knowing exactly when you're going to ovulate in the first place. Ideally, a monthly menstrual cycle should last 28 days, with day 1 being the first day of your period. Some doctors state that ovulation is usually on day 14 of a menstrual cycle, so many women decide to plan to have sex on day 14, hoping to increase their chances of getting pregnant. The problem with this approach is that not every woman has an exact 28-day cycle. Similarly, not every woman will ovulate on exactly day 14. You might ovulate on day 10 or on day 17. There are ways to predict ovulation using basal body temperature kits or ovulation predictor kits, both of which are available at most pharmacies. However, the single most reliable predictor of when you're at your most fertile point of the month is on the day you notice the most fertile cervical mucus discharge. Cervical mucus is the discharge that is sticky, clear and a little like raw egg white. Having sex when you notice the cervical mucus is important, simply because this discharge is what aids sperm in surviving and swimming to the egg more effectively. Timing when to have sex. Unfortunately, when many women decide to put off having sex until they notice their cervical mucus discharge, they tend to abstain completely until it's the right time. They also tend to avoid sex at other times during the cycle. This can mean sex becomes a chore or a routine. It becomes less about love and connection, which can increase strain on a relationship and increase stress levels for both of you. Of course, you may also find that, even though the woman might be at her peak fertility time, you could be reducing the male's sperm quality without even knowing it. You see, if you wait to have sex for a week or two before you notice the signs of ovulation, you risk your partner's sperm quality being at less than peak quality. This is because a male's sperm quality and quantity will peak after only 1 or 2 days of abstinence. If you've made him wait for 10, the quality and quantity may not be ideal for optimum fertility rates. Ideally, if you're planning to conceive, having sex twice a week, regardless of the fertility signs, can actually strengthen the connection between you, as well as increase fertility for each of you at the same time. Stop timing when to have sex and work on having a little fun together instead. Good sex equals better chances of conception. As mentioned in the previous section, many women become so preoccupied in trying to figure out the right time of the month to have sex that they forget about having fun and enjoying it. When you have sex based on a calendar or a timetable, it can lose a lot of the fun factor. This can build resentment and cause stress, which can become a factor in keeping you infertile. Researchers have shown that women who orgasm during sex can increase their chances of falling pregnant. This is because the spasmodic contractions of the uterus can actually help pull the sperm further into the uterus rather than remaining in the vagina, where it can leak out far more easily.